Welcome to the Omnidental Podcast. So imagine you are out at a really nice dinner, right?
Okay, I'm picturing it.
You take a bite of this soft, warm artisan bread and suddenly crunch.
Oh no, that is the worst sound.
Yeah, because you know it wasn't the bread. That was your tooth. Or, well, actually, the filling that used to be inside it.
It is a very specific, visceral kind of crunch that just stops you dead in your tracks.
Exactly. The panic sets in immediately. I mean, you run your tongue over the spot, and there's just this gaping, sharp canyon where a smooth filling used to be. Suddenly, your nice evening is totally over, your heart is racing, and your brain is just spiraling into these worst-case scenarios.
Well, your mouth is such a sensitive, highly innervated area, so when its structural integrity is compromised like that, it completely hijacks your nervous system. You really can't focus on anything else.
No, you can't. Well, if you have ever experienced that sheer panic or, if you just want to be incredibly well prepared for the future, you are in exactly the right place. Today's deep dive is your absolute lifeline. We are building a step-by-step emergency protocol to save your tooth and, just as importantly, to save your peace of mind.
Which is so needed when that panic hits.
Yeah, and we are drawing today's insights from a fantastic expert article written by Dr. Bylis Poles. This was published on April 3, 2026. And we're pairing that alongside the incredibly comprehensive patient resources from Omni Dental and Med Spa in Arlington Heights, Illinois. By the end of this conversation, you'll know exactly how to cut through the panic with practical, actionable knowledge.
And that actionable knowledge is so crucial because dental emergencies are tricky. I mean, the immediate pain and the psychology of the situation often make us want to do the wrong things, or worse, simply freeze up and ignore it out of fear.
Yeah, ignoring it is definitely a bad idea. So, okay, let's unpack this. We need to start right at the moment of crisis. The uh-oh moment. You just realized the filling fell out, you're sitting at the restaurant table, and the panic is creeping in. What's the very first thing you do? Because reading through Dr. Poles' protocol, the priority is all about acting quickly to protect that newly exposed tooth.
Oh, right, because the protective seal is just gone. To understand why this is an emergency, you have to look at the anatomy of the tooth. The outer layer, the enamel, is the hardest substance in the human body.
It's armor.
Exactly, it's armor. But once a filling falls out, the inner layer, the dentin, is completely exposed to the elements of your mouth. And dentin is not solid armor. It is highly porous.
Oh, wow. Pores like a sponge.
Sort of, yeah. It is packed with thousands of microscopic tubes called dentinal tubules, and those lead straight down to the pulp where the nerve lives.
So it's basically a direct highway for pain and bacteria.
Precisely. That's why the very first thing you do, as soon as you can get to a sink, is rinse your mouth gently with warm salt water.
Which sounds like an old wives' tale, honestly.
Wow.
Salt water. Is there actual science behind that, or is it just something our grandparents told us to do?
Oh, no. There is profound science behind it. This raises an important question about how we clean the area. The saltwater rinse is executing two critical biological jobs. First, it's a mechanical flush, gently lifting out any food debris.
Like that piece of artisan bread.
Exactly, lifting out anything that might have gotten wedged into the open cavity. But second, and more importantly, it utilizes the principle of osmosis.
Osmosis. Like from high school biology.
Exactly like high school biology. By mixing salt into the water, you create a hypertonic environment. This means the water in your mouth now has a higher concentration of salt than the fluid inside the cells of the bacteria lurking in your mouth.
Okay, I think I see where this is going.
Right, nature always wants to achieve balance. So the water inside the bacteria cells actually rushes out through their cell walls to try and dilute the salty environment around them.
Wow. So it literally dehydrates and neutralizes the bacteria on contact.
It severely inhibits them, significantly lowering your immediate risk of infection. Once you've done that, the rule is simple. Absolutely do not chew on the affected side of your mouth.
Right. And I assume pop some over-the-counter pain relievers to manage the throbbing.
Yeah, that helps immensely.
But I want to pause on the next step of the immediate triage protocol because this is where I get a little nervous. The sources mention that if you have it available, you should apply an over-the-counter temporary filling material. You can buy these little putty kits at most pharmacies.
Yes, you can usually find them in the dental aisle.
Now, to me, losing a filling feels exactly like getting a sudden hole in your roof during a massive rainstorm. You are taking on water, and you just need to throw a temporary tarp over the hole to stop the damage before the professional roofing contractors arrive.
That is a highly accurate way to visualize it. The temporary putty is your tarp.
But here is my concern. Is using that temporary filling material actually safe? I mean, I'm not a trained dentist. If I just shove some pharmacy putty into a hole in my tooth, couldn't I accidentally trap a bunch of nasty bacteria inside the tooth if I don't apply it perfectly? Am I basically just locking a monster in the basement?
That is a brilliant question, and it is exactly why that initial hypertonic saltwater rinse is so absolutely vital.
Ah, so that cleans the basement first.
Exactly. That rinse is your mandatory sterilization step before any temporary cover goes on. But to address your fear, you aren't permanently sealing the tooth. Over-the-counter, temporary fillings are not capable of creating a true biological hermetic seal.
Yeah, okay.
You are really just providing a physical barricade against the immediate invaders, things like a sudden blast of cold air, hot coffee, and new food particles.
Okay, so it's a barricade, not a permanent vault door.
Right. It's designed specifically to be easily scraped out by your dentist later. It's just there to cover those dentinal tubules so the fluid inside them stops shifting and pulling on the nerve every time you take a breath of cool air.
Which sounds like a huge relief.
It is. But to your point, it is a temporary tarp. You cannot live with a tarp on your roof forever.
Which brings us to the most important triage step. Call the dentist immediately to schedule an appointment.
Yes. It buys you a day or two, perhaps a weekend if you are in a pinch. But you must get a professional to replace the permanent seal.
Okay, so the immediate panic is managed. The tarp is on the roof, you've called the clinic, and now you're sitting on your couch, inevitably wondering, why did this even happen? Aren't fillings supposed to be permanent fixtures? You drill the hole, fill it with metal or resin, and it's good for life, right?
We really do tend to think of teeth like stones and fillings like concrete patching a brick wall. But the reality is far more dynamic and honestly a lot more volatile.
Here's where it gets really interesting. Because reading Dr. Pohl's breakdown, it sounds like an extreme environment. It's basically a geological fault line there. You've got wild temperature swings, massive mechanical crushing forces, and constant chemical attacks happening every single time you eat.
The physical forces your teeth endure are staggering. Let's look at the thermal aspect first, because it's something we do completely mindlessly. Think about your morning routine. You take a sip of steaming hot coffee, and maybe immediately followed up with a bite of cold yogurt or a sip of ice water.
I do that all the time. Hot coffee, ice water, back and forth.
Chemically and physically, the materials in your mouth respond dramatically to that. This is especially true for older amalgam fillings, which are the traditional silver-colored metal-based ones.
Right.
Metal expands with heat and contracts with cold. It's a fundamental property of the material. When you drink that hot coffee, the metal filling expands microscopically inside the rigid enamel of your tooth.
Wait, inside the tooth?
Yes. And when you drink the ice water, it suddenly shrinks.
Oh, wow. I never thought about thermal expansion happening inside my own face.
It happens every day. And over years and years, this micro-expansion and contraction cycle eventually weakens the bond between the filling material and your natural tooth structure.
That makes sense.
It's a lot like bending a paperclip back and forth eventually. Metal fatigue sets in, the seal breaks, and a microscopic gap forms.
And I imagine a microscopic gap in a mouthful of bacteria is a very bad thing.
Very bad.
Which brings up the biological factors the sources mention. Poor oral hygiene and new tooth decay can actually weaken the bond from the inside out. So if a filling falls out because the bond was weakened by new decay, does that mean the filling was essentially hiding a secret cavity brewing underneath?
Yes, what's fascinating here is that we call it secondary decay, and it is arguably the most common reason a filling just falls out during dinner. Once that thermal expansion or daily grinding creates a microgap, bacteria, specifically acid-producing bacteria, slip into that tiny margin between the filling and the tooth.
And you can't reach them with a toothbrush anymore because they are hiding under the metal awning.
Precisely. They set up camp in a highly protected environment. They consume the sugars you eat, produce acid, and slowly dissolve the healthy tooth structure that is actively supporting the filling.
Oh, so it's like termites eating the wooden studs behind your drywall.
That is a perfect analogy. Eventually, the foundation crumbles, and the filling simply falls out because there is literally nothing left for it to hold on to.
That is terrifying.
Yeah.
But mechanically, it makes perfect sense. So while you're trapped waiting for Tuesday's dental appointment, knowing this hidden decay might be present, how do you keep that bomb from going off? What are the rules of engagement while you manage the wait?
First and foremost, avoid very hot or cold foods entirely. Because that insulating layer of tooth might be gone, the nerve is much closer to the surface.
Right, you don't want to agitate it?
Exactly. Temperature extremes will cause a rapid shift in the fluid within those dentinal tubules we talked about, resulting in sharp shooting pain.
That makes sense. But the second rule in the protocol is the one that really gives me pause. It says to maintain gentle oral hygiene on the nearby teeth using a soft bristled toothbrush.
Yes, that's crucial.
I have a major question about this. Using a toothbrush, even a soft one, right next to a gaping, highly sensitive crater sounds like a terrible idea. Aren't we risking slipping, stabbing the exposed nerve, and sending ourselves to the ceiling in pain?
It sounds counterintuitive, I know. But if we connect this to the bigger picture, you have to think about the body's immune response. When a tooth is exposed, the absolute last thing you want is a heavy buildup of plaque and bacteria in the immediate vicinity.
Okay, why is that?
Because if plaque accumulates, your immune system kicks in, and the surrounding gum tissue becomes highly inflamed, swollen, and prone to bleeding.
And a bloody, inflamed gum line probably makes a dentist's job a lot harder.
It makes it nearly impossible. Dentists need a clean, dry, healthy field to properly bond a new composite resin filling. If your gums are weeping fluid because they are inflamed from plaque buildup, the new filling's chemical bond will fail.
Oh, I see. So you aren't scrubbing the hole itself. You're carefully keeping the neighborhood clean so the dentist has a healthy environment to work in. Okay, keep the neighborhood clean, but don't scrub the actual construction site. Got it. But what if it really hurts? The sources highlight severe pain as a crucial warning sign.
Pain is not just an annoyance in a dental emergency. It is a vital diagnostic tool. It is your body's alarm system, and the type of pain tells a very specific story about how deep the breach goes.
Right, it dictates whether you're getting a quick patch job or something much more intense.
Exactly. If you have a mild, fleeting sensitivity to cold, it usually means the damage is relatively superficial, confined to the outer layers of the dentin. A simple cleaning and a new filling will completely solve the issue.
That's the best case scenario.
Yes, but if you have severe throbbing pain that keeps you awake at night, or if it hurts intensely when you bite down, that suggests the bacteria haven't just hollowed out the foundation, they have reached the inner pulp chamber.
And the pulp chamber is the command center where the nerve and the blood supply are.
Yes. If bacteria breach the pulp, the nerve tissue itself becomes infected and inflamed. Because the tooth is a closed, hard shell, that inflammation creates immense pressure, which causes that unbearable throbbing pain.
Oh, wow.
In that scenario, a simple refill won't work. You are likely looking at a root canal to remove the infected nerve tissue before the tooth can be safely rebuilt and sealed.
Which perfectly explains why acting fast and getting into the dental chair is the ultimate goal. So let's talk about that professional fix. The waiting is over. You've managed the pain, utilized your hypertonic salt water, kept the neighborhood clean, and now you are finally sitting in the clinic.
The relief of finally being there is huge.
Oh, I bet. So how does a professional actually fix this, and what materials are they using?
The procedure is a highly methodical rescue operation. First, the dentist must meticulously inspect the area and remove every microscopic trace of that hidden secondary decay. As we established, you can't build a new house on a rotten, termite-eaten foundation.
Right.
Once the cavity is perfectly clean and sterilized, they choose the right replacement material.
The sources mention the two primary options: composite resins, which are the tooth-colored materials, and amalgam, the traditional silver-colored ones. But I'm curious, how does the dentist actually choose which one to use? Are they bonding to the tooth differently?
They behave entirely differently. Amalgam is packed in mechanically. The dentist shapes the hole so it's slightly wider at the bottom than the top, effectively wedging the metal in place as it hardens.
Oh, interesting. Just physically wedged in.
Yes. Composite resin, however, bonds chemically. The dentist applies a mild conditioning gel that opens up microscopic pores in the tooth enamel and dentin, and the resin flows into those pores, creating a true micromechanical lock when cured with a special light.
That sounds much more integrated.
It is. Today, composite is overwhelmingly preferred because it actually reinforces the remaining tooth structure rather than just wedging inside it.
And this brings us to where you're getting this highly technical work done. Today's insights are pulled directly from Omni Dental and MedSpa. They are led by Dr. Billis Poles, who brings over a decade of specialized experience in treating exactly these kinds of complex dental injuries and emergencies.
And accessibility matters when you are in pain. Omni Dental is anchored in Arlington Heights, but their service area covers the entire surrounding region, which is exactly what you want.
Yeah, the sources mentioned they serve Buffalo Grove, Palatine, Mount Prospect, Rolling Meadows, Schaumburg, Wheeling, Plains, and Elk Grove Village. When a filling falls out and you suspect the nerve is exposed, you don't want to be driving across the state. You want local, expert, highly precise care.
Absolutely.
So what does this all mean? Omnidental isn't just an emergency room for your mouth. It's a comprehensive med spa. And at first glance, pairing dentistry with med spa services might sound, I don't know, unusual to some people.
It really might.
Right. They offer general dentistry, cosmetic procedures, full-arched dental implants, bone grafting, Invisalign, and root canals. But under the exact same roof, they offer aesthetic services, Botox, dermal fillers, microneedling, laser hair removal, IV drip therapy, and permanent makeup like microblading.
It might sound unusual initially, but anatomically and medically, that combination actually makes perfect sense. It represents a brilliant evolution in how we approach facial health care.
Right, because who knows the architecture of the human face better than a dentist?
Exactly. Historically, dentistry was entirely isolated from other aesthetic or wellness treatments. But think about the training. A dentist spends years meticulously studying maxillofacial anatomy, the exact pathways of the facial nerves, the complex muscular structures, the bone density of the jaw.
They really map the whole thing out.
They do. So having the same highly trained expert who can execute a complex root canal also administer Botox or dermal fillers means you're getting aesthetic care from someone with a profound functional understanding of your facial architecture.
That is a phenomenal insight. It's truly treating the patient holistically, utilizing advanced state-of-the-art technology across the board, all while maintaining an environmentally conscious practice.
Which is fantastic.
It is. But before we wrap up, I want to pull on one more thread from the protocol. It states that promptly replacing a lost filling is critical to maintain proper bite alignment.
Yes.
Now, if you lose a filling, can a tiny missing piece of a filling, maybe the size of a grain of rice, really throw off your entire jaw?
It absolutely can. We grossly underestimate how perfectly calibrated the human mouth is. Your teeth are not just dead bones glued into your skull. They are suspended in a hammock of tissue called the periodontal ligament, which is densely packed with sensors. This provides proprioception.
Proprioception, that's the spatial awareness system, right? Like how I know where my hand is even if my eyes are closed.
Precisely. It's how your jaw subconsciously knows exactly how much force to use to bite through a raw carrot versus a soft piece of bread. Your upper and lower teeth meet together in a highly specific, interlocking microscopic pattern. If you lose a filling, even a tiny one, the opposing tooth suddenly doesn't hit its used resting partner.
Oh, so it's swinging at air.
Yes, and your brain instantly registers that structural failure. As a result, you instinctively shift your jaw and change your chewing mechanics to avoid the weird sensation or the sharp pain.
Ah, so your body starts compensating.
You compensate, and that compensation sets off a chain reaction. It heavily stresses the muscles on one side of your face and jaw joint, which can lead to severe temporomandibular joint pain, chronic tension headaches, and uneven destructive wear on your remaining healthy teeth.
From just one missing grain of rice.
From just 1 millimeter of missing material. It fundamentally changes the mechanics of your bite. This is why Dr. Pohl's emphasis on using advanced technology for precise treatment isn't just a buzzword. They aren't just plugging a hole. They are restoring a highly calibrated biomechanical machine to its exact factory settings.
And to keep it at factory settings, the protocol ends with the ultimate necessity prevention. Once Dr. Pohl's and the Omnidental team fix you up, the responsibility shifts back to you. To stop this from happening again, you must maintain proper brushing and flossing habits.
Which is the foundation of everything.
Exactly. Limit the sugary fuels that feed those acid-producing bacteria. Use fluoride toothpaste to actively remineralize and strengthen your enamel. Avoid reckless habits like chewing on ice, and attend your regular checkups.
Prevention is vastly superior to intervention. A regular checkup allows a dentist to look at the microscopic margins of your old fillings and say, hey, this amalgam is showing signs of metal fatigue. Let's replace it now on our own terms, rather than waiting for it to fail while you're eating dinner on vacation.
Right. Ruin the dentist visit, not the vacation.
Yeah.
Let's bring all this vital knowledge together. Here is your ultimate emergency protocol. If you lose a filling, do not let panic take the wheel. First, use a warm saltwater rinse to trigger osmosis and dehydrate the bacteria.
Casual first step.
Second, protect the tooth. Use over-the-counter pain meds and a temporary putty if you have it to block the elements. Third, protect the neighborhood. Keep brushing gently around the area, but do not chew on that side.
Right.
And fourth, call an expert like Dr. Pohl's and the team at Omnidental and MedSpa right away. Acting fast stops hidden decay in its tracks, prevents nerve infection, and keeps your entire bite perfectly aligned.
It's a flawless protocol. And it leaves me with one final, broader horizon to consider. We've talked extensively today about how temperature changes, expansion, and biting forces cause traditional static fillings to eventually fail.
Yeah, that metal fatigue.
Right. It makes you wonder, as dental technology continues to advance at this breathtaking pace, will the future of emergency dentistry move away from inert materials like composite and amalgam entirely? Might we soon rely on bioactive materials that don't just plug a hole, but actually adapt, shift, and actively regenerate alongside your natural enamel over time?
Now, that is an incredible thought. A filling that actually acts like living armor growing with you. Until that sci-fi future arrives, though, just remember, keep the salt water handy, don't chew the hard stuff, and trust the experts to fix the roof when it starts leaking. Thank you so much for joining us on this deep dive into dental emergencies. We hope you walk away feeling a little more prepared, a lot less panic, and ready to protect your health. Stay curious, keep learning, and we will catch you on the next deep dive.